How are you?
Good, how are you?
Great, I'm John, I'll be your PA today. So what is your chief complaint?
So I'm a 35-year-old female with abdominal pain.
Yeah.
Alright. When did this begin?
Um, 1 hour before coming to the emergency department.
Where?
It's up on my left side, in the lower left side.
Lower left side?
Yeah.
Okay.
About an hour ago before I came to the EP.
Where approximately is the pain?
You said that it was an hour ago
it's
when it
like-
started.
Yes.
Down here? Like more closer
Could you
to
describe the
hip
pain
or
for me?
closer in the
Like
abdomen?
the whole
It's
body.
dull,
Okay.
achy, and it waves, and at times it's intense and squeezing feeling.
And how long has that been occurring for?
Just about an hour.
An hour?
Does anything make it worse or better?
When the pain is present, pushing on the area, or anytime I move, it hurts.
When it's painful, when I push on it, it feels worse, or when I move, in general, it feels worse.
And
And then I took 600 milligrams of ibuprofen, but and it kind of just comes.
could you rate the pain for me?
It sometimes is a 0 out of 10, but sometimes I can rate it a 10 out of 10.
Oh, wow.
And then can you rate the pain for me?
Alright.
Sometimes it's 0 out of 10, but then can go up to a 10 out of 10.
And is there anything that,
Alright. Have you had any other complaints recently? Or medical history?
how
I
long does
should
it
know about.
usually last when you have like an exacerbation?
I had a large ovarian cyst 3 or 4 times in the past. Nothing else, or no overnight hospitalizations, so just the cyst.
And
Does this feel like
does
that
it
pain?
radiate anywhere else other than like the
Yes.
Not really, but maybe
Do you have any allergies?
kind of lower. Here,
Lower?
in the middle.
Okay.
No allergies.
And are you currently, have you experienced any like nausea, vomiting, dizziness?
Are you sexually active?
Yes.
So I vomited once when the pain was like 12 out of 10.
Multiple partners? One?
And then I'm sometimes nauseous when the pain is.
1.
One. And you use protection?
Any fever, chills?
Yes.
No fever.
My husband had a vasectomy 1 month ago.
Okay.
Do you have any chest pain, cough,
Have you ever been pregnant before?
shortness of breath?
Yes, 1 time.
Only short of breath when the pain
And do you have a
is
child
worse.
from that pregnancy?
Yes.
And we'll say no to the other things.
Previous hospitalizations?
Are you currently menstruating right now, or are you on any form of birth control?
No. No.
I'm menstruating right now. And
When was your last menstrual period?
When is your
I'm on my period now.
Okay.
so are you currently on any
And is that
medications
normal?
other than the Advil?
Yes.
Okay. No. And any allergies?
No.
Any pertinent past medical history? Any hypertension or diabetes, anything like that?
not those. I did have
Are you on any medicines?
some large ovarian cysts 3 or 4 times, but that's it.
I'm on no medications.
No meds.
Okay. And any surgery history?
Smoke, drink?
I had one of
Use
those
any
large
drugs?
cysts 6 months ago, and then before that 2 years ago.
I do not drink, I don't smoke, and I don't do drugs.
So that.
Okay.
Same size as your
Do you have any family history of disease, surgeries?
No. No family history.
And immunizations up to date?
hospitalization, so I would assume I'm going post-surgical.
Yes. Yes.
Okay. Any recent travel?
Right now?
Yes.
Is it on a
Um,
regular cycle?
No,
Approximately? Okay.
How about trauma?
Uh,
no trauma.
and do you think you might be pregnant? Have you ever been pregnant?
Once.
What, one child? And how did the pregnancy go?
Just normal. I mean,
Normal.
Did I ask if anything alleviates the pain?
Seems to come and go with minimal improvement with 600 milligrams of
Did you
ibuprofen.
pregnancy test recently?
No.
Psychiatric
How about urinary frequency or any changes in urination or
ovarian
in
cysts,
defecation?
Urinary, I don't have any urinary problems.
abortions, spontaneous
And your bowel
abortions,
movements?
miscarriages,
Diarrhea, constipation.
anything
I do
else
not
on
have
that?
diarrhea
Diseases or anything like
and no
that?
constipation.
Okay. Nausea, vomiting?
Vomiting, once when the pain was worse at like a 12 out of 10, I vomited.
Okay.
And nausea sometimes when the pain is really high.
Okay.
Okay, and have you noticed any like dizziness upon standing? Rapid
Have you had a fever recently?
I feel like your pulse is racing.
No.
No fever.
No.
Fever. Any shortness of breath? Chest pains?
Shortness of
Coughing.
breath when the pain is at its worst. No coughing. What was your other question?
I think that's all
Okay.
of that. Any palpitations or?
No palpitations.
Menstruation. It's what time?
Plenty right now. You're at 8 minutes.
Can you describe the radiation as
The radiation,
from lower left quadrant?
that's the location, but it radiates into the central pubic area. But it doesn't really radiate a lot.
Okay.
You had any difficulty urinating, bowel movements,
Bloating, cramping,
colitis, cirrhosis?
No different.
painful urination,
No painful urination. No bloating or cramping.
Have you noticed any vaginal discharge or itching, discomfort, anything like
No.
that? Would you say, is the pain similar to that of the cyst that you've had in the past?
It's worse.
Worse?
Worse than those.
You said that you're not on any form of birth control?
My husband had a vasectomy.
any history of psychiatric illness?
No.
Have you had unprotected sex since his vasectomy?
Yesterday.
Okay.
Where are you currently in your sex?
I am having a period right now.
Is it 7 having any menses, 1?
Side date.
No back pain at all?
No flank pain, no.
No flank pain.
Any problems with
have you noticed any blood in the urine or stool?
No.
Okay. I think I'm ready. I have a 35-year-old female presenting with lower left quadrant abdominal pain. About 1 hour ago, radiates from the left lower quadrant to the central pubic area. Comes in waves, described as dull and achy, but can be intense and squeezing at times. And it ranges from 0 to 10 to 12. 600 milligrams of ibuprofen taken with minimal alleviation of pain. Family history is positive, medical history is positive for 3 or 4 ovarian cysts in the past. There is no fever. She uses protection, and the husband's had a vasectomy a month ago, and is currently on her menstrual period. And there's no flank or back pain, no trauma. Everything else appears normal. So I think that because this pain was like the ovarian cyst that she's had in the past, it's likely an ovarian cyst, although I'm also worried about an ectopic pregnancy. Even though the husband had a vasectomy, it might not be taken. Or possibly a diverticulitis. I get to keep this one.
The other thing to think about is ovarian torsion. That's what it actually is.
It's actually
Yeah,
torsion.
which you're not